all works. Hello, folks. This is the American Association of Food Safety, Public Health Veterinarian YouTube channel and podcast. We're on season 1, episode 9. And today I'd like to welcome Dr. Arnold Goldman. He goes by Arnie for his friends, of which we all are. And he has his master's in public health, along with some other very interesting designations that we'll go through as we start in. So first of all, I like to always ask where you are located. Tell us where you're at right now, Arnie.
I am in my own office, which is in my clinic, and that clinic is in Canton, Connecticut. It's a central Connecticut, semi-rural or suburban area.
Yeah, so I want to point out to everyone you're practicing medicine, and I can see here that you graduated from veterinary school right about the same time I did. So you've been in clinical medicine the whole time since you've been out?
I have. It's coming up on 35 years, I hate to say. Yeah.
Okay. So I like to also start with understanding what brought you to veterinary medicine in the very beginning when you started thinking about being a veterinarian. Tell me a little bit about your, let's call it, origin story. Go ahead.
Okay. All right. I'm happy to do it. Well, I mean, if you really want to go back, so I grew up in Staten Island, New York. It's at the time it was a semi-suburban or ex-urban community, semi-rural in some respects, very urban in others. And I was an only child, adopted by my parents as a baby. And my parents were very empathic towards animals. You know, my dad and my mom both loved animals. Now, we were, I don't want to say poor, but we were pretty modest means. You know, I didn't actually have a dog or a cat till I was already in my late teens, almost going to college. It just wasn't an expense we could manage. But other pets I had, you know, and so that was my exposure. And my dad was a guy who he would try to fix birds that he'd find that were injured and that sort of thing. And so I was exposed to that feeling early on in life. And then I had many friends, of course, and many of them had pets. And so my interactions with animals encompass that. And then there was a place in upstate New York back in the day called Catskill Game Farm. And my various family members would bring me up there. And it was basically a domestic animal petting zoo at a time before a lot of regulation and really a lot of awareness of public health issues that go along with that. And so I went there many, many times. And then many of my family members, my parents and my extended grandparents and all, would take me to all the zoos in the area. So in New York, we had the Staten Island Zoo, which I would probably have been at, you know, monthly during my entire childhood. And then the Bronx Zoo, and then there's in Brooklyn, the Prospect Park Zoo. So I was very familiar with all of those places. And, you know, there's a lot of cultural things in New York, as you know, museums and such. So I had an interest in science. I had an interest in animals from a very early age. And that kind of led me along. I didn't know that I would want to be a veterinarian even into college, because I'd never really met a veterinarian.
Of course, if you didn't have a dog or cat, sure.
Right,
and then
the animals I had were frogs and hamsters and various snakes and such. And but I had the feeling for it. And then I majored in biology at one of the State University of New York campuses at a place called New Paltz. It's near Poughkeepsie, New York. And I was near the end of well, I was already into my third year, like junior year of college, you know, well along in a biology major. And I needed like an extra credit for a given semester. And there was a local veterinarian who offered a class that was called Pets Care and First Aid.
Oh, and that was right up your alley, because your dad was there taking care of whatever injured creatures showed up. So,
yeah,
okay.
Exactly. So I needed this one credit. I didn't want to, you know, take some sociology or some other thing that really I wasn't really interested in. So I took this class, and part of the class was going to the veterinarian's practice and observing. And I was hooked like almost instantaneously. He had a younger associate who was closer in age to me, maybe he was less than 10 years apart. We kind of hit it off, and I kept going back. And that one thing led to another. So, of course, I got an A in this. It was a class for non-science majors, a science class for non-science majors, but I just took it to fill my schedule that particular semester. And I just kept going back, and I started thinking about veterinary school. And at the time, there were 18 schools in the United States. I came up with a book, and it was a hardcover book. It was
Right. I totally get the line.
this book, Veterinary Colleges of the World. I still have it.
Okay. Yeah.
And so that led me to that. And then the next step was I started looking at what was required to get into veterinary school. And of course, at that time, it was sort of understood that if you were from a state that had a veterinary school, you were expected to apply to that school.
100%. There was very little choice. Absolutely. Yeah.
The Western states had different relationships, but I was from New York, so that was Cornell, an excellent school. At the time, they took 60 students a year. They took 30 men and 30 women. So that you start cutting the numbers down, and then they took a small number from New York City, and then everybody else from the upstate region. And so when you started, doing the math, my GPA at the time was not a GPA that was going to get me into, say, one of the dozen or so slots reserved for male applicants from New York City. It just wasn't going to happen.
Sure. Yeah.
So I did some additional work after undergrad, and I ended up in a master's program at the University of Florida.
Oh, that's how you got your master's. Okay, sure.
The first master's, yeah. It's kind of a funny story. There was a professor at Florida his name was Dallas Hyde. He was a pulmonary researcher. He started out at UC Davis, and for some reason, somehow he ended up in his professional career at the University of Florida, where he partnered with Darrell Buss. You may know that name because he was a dean at Wisconsin and a dean at Florida subsequently. But in any case, so Dallas agrees to take me on as a graduate student. This is 1979. We're in a gas crisis, okay? And I'd never really been outside of New England never been on a commercial airliner in my life. So I had a pickup truck. I loaded up all my possessions, and my father and I rigged up a spare gas tank. And so in the bed of the truck, so I could get to Gainesville without having to find gas along the way, because no one knew if you could.
Right.
And I made it from Staten Island to Gainesville without stopping for gas.
That's not an unusual trip between New York and Florida. Let's just say I know it well because I'm from Florida and we used to go up to New York. So there you are.
So so I get all the way to Gainesville. I arrive mid-afternoon on a weekday, and I find the lab, and I go up to the lab. And when I go up there, I find Dr. Hyde and a couple of graduate students packing up all his stuff. From the time I agreed to be taken on as his graduate student, and there was a teaching assistantship associated with it, so I could help pay my tuition.
A little bit of money, sure.
In that time, was a few days, he accepted a higher level of professorship back at UC Davis, and was packing up his stuff. And no one thought to call me.
No one told you. Well, you were already on your way. I don't know what it is. They just didn't get a hold of you. They forgot you. I don't know.
I just drove 1,000 miles. I walk in, and he's leaving, and so he gave me a choice. I could either press on to Davis.
Across the country, sure.
Right, be his graduate student out there, which that was fair, or I could stay where I was, and Dr. Darrell Buss, would take me on. We would end up doing the same project because they were collaborating on this particular project, which was collateralization of the canine myocardium. Why?
That's fair. And this was for which master's? What was that master's program called?
It ended up as it's a Master of Science. Physiological Sciences.
Oh, okay. Beautiful.
And this is mostly pre-computer. There was a technique known as stereoscopy, where you would stare in a dark room through a glass with a grid superimposed on it and count how many capillary margins touched the lines in the grid. And from that,
Oh, boy.
yeah, and from that, a little calculus would lead you to the volume of capillaries per unit volume of myocardium.
And this was a 2-year program that you counted the grid?
Well, it was yeah, it's technically it would have been 2 years. Anyway,
Okay.
so, and there's a whole bunch of coursework with it.
Sure.
And it took me a while to finish it, but I did finish it because I
Hmm.
felt strongly at the time, like I really wanted to go to veterinary school. And of course, the reason I took that program was because Florida had a brand new veterinary school.
They did, yes, and that's exactly true. I remember that. Hmm.
I think I ended up in the 4th class or 5th class. I think the first class was, yeah, well, whatever. I can't remember right now. But the point is, I had this strategy. I would do the masters, I'd get to know some people, and I would eventually earn my way into a place.
True.
And it did kind of work out that way, but I didn't want to apply the first year because I had just gotten there and I didn't want anyone to think I wasn't going to finish the masters. It's kind of a lesson my parents instilled in me: always finish what you start. And so anyway, so I did that. I stayed with Dr. Buss. I did all my coursework. We started the research there. It involved electron microscopy and a bunch of other neat techniques that I got to learn. And then on my second application, I got into UF College of Veterinary Medicine.
Okay.
So the research was done, but the analysis and the thesis writing was not done. And that ended up on hold for almost the entire time of my veterinary school career. And in my junior year, when I had that semester, they were on a quarter system at the time. I ended up with a quarter off, and that's when I ended up completing that. I had to go back. I ended up back at UC Davis for the winter of '82, working in Dallas Hyde's lab out there. And
okay. So you did end up there with him again. Okay.
Yeah, it was a neat time. He put me up in his house. He gave me a bicycle to ride around the Davis campus. It was an interesting time, a really interesting time. And I spent a lot of my days in a closet counting capillaries through this mesh.
Gosh, right.
But,
dedication. Well, you know what? We really did have that dedication to get into veterinary school back then. You're right. There were not a lot of vet schools. There were not a lot of openings, and you literally had to do that. So for you to get an advanced degree and show that you were committed, that's really what it took back then.
Yeah. They saw that I wasn't going to quit. And so I think that mattered. I was popular with the lab staff out in Davis because all day I'm in the closet. I had the AM radio on, and I had a phone, and they were giving away lift tickets for skiing in the Sierra if you knew, trivia and such. So I all through the days I would be calling up, and eventually I'd get on. I must have won half a dozen or more pairs of lift tickets, which I gave out because I had no skis with me and I had no time. But I gave them out to all the staff, so I was popular with them for that reason.
Hey, lift tickets cost a lot back then too.
Yeah, they did. Yeah. So anyway, so I came back to Gainesville after that and started veterinary school in the fall of '82. With I want to say it might have been the 6th class. I cannot recall. But anyway, and since I had been a teaching assistant for the almost 3 years before, helping out in the freshman anatomy class, I ended up getting sort of opting out. I didn't have to retake.
Oh, you're kidding me. Anatomy at that time was my bane in vet school. Good for you.
It was my favorite too. I just loved it. So, that was good. I used the time wisely because I needed the time to into the other classes. I mean, I don't know why, but it just kind of worked out that way. Anyway, so finished veterinary school, and in the years in between, my father had passed away. And so I felt a strong need to come back to the Northeast, be relatively close to my mother and the rest of my family that was left at that time. So I moved to the Northeast. I ended up in a rotating internship at a place it was called South Shore Veterinary Associates, just outside of Boston. There were a bunch of boarded people there. And I lived in an apartment nearby in Quincy, Mass, with a buddy of mine, a classmate from veterinary school. He's a theriogenologist now, Stephen Constant. and we roomed together for that whole year. He was at Angel Memorial, I was at South Shore, and we basically each were doing internships, and we each were busy, that's for sure. After that, I ended up in Rhode Island, and then eventually in Connecticut.
So when you were finishing out with vet school, were you dead set on getting an internship? Was that a natural progression for you to do an internship, or was it?
No, it's a good question.
Mhm.
I was told by a few people that at the time, at least, and again, remember at that time, internships were very scarce. It
Mhm.
wasn't like there was
yeah.
hundreds like now. Maybe there was 60 or 75 positions around the country. It was some number that was that low. And I was told that a single year in a very busy rotating internship, competitively matched type program would be equivalent to 3 to 5 years in practice working for someone else, like an ordinary associate.
True.
And I was a guy in a hurry to be successful, I guess. I as I told you, I came from a family that was of modest means, let's say, and I needed to show that I sort of fulfilled all our dreams. So anyway, so I figured, well, if I can get all that experience quickly, then I'll be more productive later and do better. And to some extent, that was true. I mean, I spent 1 year and I did a bunch of different surgeries, and most of my colleagues at that point, were not that experienced, and I had that experience.
Well, sure. When you first get out, you'll be perhaps relegated to the spay and neuters. But in your instance, when you did the internship, you said you had board certified veterinarians that were working alongside you. So you had that expertise that you could lean on. And that's what essentially promoted you along with your abilities.
Yeah, it did help a lot. I mean, in a practice like that, they're not going to let you do complex surgeries. But unlike in veterinary school, where you're one of 6 or 8 people jostling even to see, I got to scrub in, I got to hear the commentary, and, it became the sort of watch one, do one, teach one phenomenon to some extent, where I knew I was capable of doing these things. I'd seen them enough times.
So your job over in Rhode Island, was that your first regular clinical associate position?
It was. And I was given the freedom to do a lot of surgery there, and many of the procedures that I, learned in my internship, I was able to do, myself there. So.
And I expect that was a bigger exposure to what it was like to run a small business.
I didn't get a lot of the business experience there, but I got sort of human interaction experience. I think maybe it's because I was an only child. I don't know. I was a little bit slow on the uptake of, how to manage clients. And, I think I've finally arrived now, but, it's taken a lifetime to develop those skills.
Oh, let's just face it. As veterinarians, we get along so well with animals, and really that's our forte.
But you've got to, it's a people profession. People told me that early on. Previous mentors sent me to Dale Carnegie classes, and just all sorts of things.
Oh, what an interesting thought. Okay, so you really did focus on learning about how to interact with people. That's an interesting that's an interesting idea, and one that you certainly could utilize, no matter whether it was back then. Of course, there was the Dale Carnegie, or now whatever would be available in terms of interactions. I guess maybe that you never can be you never can be short on learning how to communicate more effectively, is really what I'm saying.
And it's interesting how things come back around, because right now so many young people are seeking out and need sort of leadership training, whether it's personal leadership or just leadership of others. You hear of the classes, if you look at the offerings at conferences, and the sort of things that are focused on, and the challenges that the students face. There's this thing now where students, or not students, but young veterinarians are distraught over the way clients treat them. And I would say I've had my fair share of difficult people, but you learn over time how to set boundaries, what's appropriate, and I think there's a need for that kind of training right now.
Oh, yes, absolutely. And I'm in a Facebook group that talks about what happens when someone is faced in clinical medicine, when somebody is faced with a poor review on social media and how to answer those reviews. And it is very eye-opening. I think as veterinarians, we tend to take it extremely personally when we see these reviews. And what I learned last year when I did 1 year of intensive digital media marketing, really from the viewpoint of trying to learn how to operate in digital media. And I was taught last year that the point really of social media remarks by clients is to give us information that we should take more as a constructive critique instead of a personal attack. And I have to admit that I really learned a lot from that viewpoint, because I was one of those people who thought, oh my gosh, I'm scared of social media reviews. And instead, it's supposed to be a matter of us learning how to listen and then respond correctly to the client or customer, and show that we are listening and we do want to make the appropriate changes. So from that point on, when you were at Rhode Island, what brought you to the next step in terms of is that when you started your own business after that?
Not exactly. I mean, I knocked around for 6 or 7 years. I managed an emergency clinic for a group in Greater Hartford. And then I started a house call practice. And I guess for me, I was, because of what happened with my family, my father had passed away, my mother was widowed. I couldn't really go home. It wasn't a place that I wanted to be anymore.
Sure.
At the same time, I couldn't go too far away because I needed to be near my family. So I sort of knocked around New England. My best friend, he and his wife lived in New Hampshire. So I had just decided that I'd probably stay in the Northeast. At one point, I had eight state licenses.
I was looking at your state licenses, and this is where I realized that you're still in clinical practice. And here I am mostly talking to veterinarians who are not in clinical practice as their main job. Now, don't get me wrong, as veterinarians, we are kind of crazy about being workaholics. How many of us have more than one job at any time?
Right.
And so, yeah, and we'll get into that with what you've done too. But still in all, so many licenses. How many do you have right now?
Well, I have 4 state licenses now, and there's different reasons for it. I mean, I do practice in Connecticut, so I have that license. And occasionally I'll help out a friend of mine in Massachusetts, so I have that license. And then New York I keep because that was my home state, and it was particularly hard to get at the time.
Yes.
New York, you may know this, they had a practical exam held at Cornell with some very challenging stations. You know, you went as far as to, palpate cows through a special table where what was inside was blacked out, and you'd put your hand in just as you would do if you were palpating a cow. And then they had actual uteruses in there, and you were supposed to palpate follicles and this sort of thing, and then tell them the stage they were at, and then the examiner would ask you other questions, and then you'd move on to the next station. They also had the notorious row of glass jars filled with various, mineral mix, various feeds, and that sort of thing. They wanted to screen out, the typical urban person who decided that was not part of veterinary medicine. And
sure.
So I'm proud.
In other words, what people don't really understand about vet school is that we do learn about every species of animal. It is certainly large animal and small animal. So in this case, they were making sure you understood your large animal stuff.
Yeah, that's right. And while I came from, an urban background, semi-urban, and I was heading to small animal practice, I guess, but I actually did the best on the dairy section. For some reason, I just had that memorized cold.
You could palpate, yeah. And when you learn how, Yeah, when you learn how to palpate, that just translates well to your brain telling you what is going on there. So when you did your house call practice, did you do anything that was a large animal or small ruminants or anything like that?
I did do some pig work. There was a period of time where so-called pot-bellied pigs were very popular.
Oh, the ones that are not supposed to be very big, but really ended up getting to be 500 pounds, and they really weren't pot-bellied pigs.
Right.
Yes, well, I know.
Right, they were landrace hogs that were just small at the time that people got them.
Yeah, sure.
Yeah, and I did quite a bit of that, and there weren't too many people willing to do it. I don't know, it was unpopular. People wouldn't bring them to the practice because they were too big. So yeah, I ended up developing a minor expertise in that area at that time. And it ended up being prescient in a way, because a pig is what got me into organized veterinary medicine in the first place. It's kind of a funny story.
Oh, that's great. Yeah, tell me, because I see you have belonged to very many veterinary organizations.
Over the years,
I do want to know how that happened and how organized veterinary medicine benefited you.
Oh, I can talk at length about that. You'll have to stop me. But what happened was, so I had done house calls for a while, and then I realized I wanted to have my own clinic. I looked at clinics that were for sale, and they weren't physically what I aspired to. I wanted something new and gleaming, and it had oxygen at the cage side, which at the time was a novel concept, things like that. I had my standards, whatever they were. Anyway, so I did a lot of relief work, and I did my house calls around here, and then I would travel and as I said, I had all those licenses. I traveled New England doing relief work whenever I could for about 3 years. I had one client, a veterinarian, who had some health issues, and she would go to Boston to a hospital to be treated. And I would fly out. I fly a small plane. I flew out to Martha's Vineyard, and I would live in this woman's house, take care of her practice and her animals. And then I would leave, on a given night, and she would come back. We never actually met physically for like 10 years, because I would just come and go. It was a great gig for me, because I was single, I could do what I wanted, and she paid me well, and I did what was asked of me, and so that was fun. But anyway, I saved up about $65,000, which at the time was a lot of money, and then I borrowed some more, and I started this practice. And right around that time, about a year later, I got a call from a colleague who I knew a little bit because I had done relief work for him, that he had gotten in a little trouble with a client because a pig who had had general anesthesia didn't do very well. And it turned out a little tragically, and he needed somebody who had a little experience in that kind of swine medicine to look at the case and try to help explain it.
Sure.
And this the colleague was the chair of the Connecticut VMA ethics committee at the time. So I got all the information, and I analyzed it, and I wrote a report showing that actually the colleague had done what was necessary, and that sometimes you get mal result regardless of your intent. And so that led to me being asked to be on the ethics committee. And then I ended up as chair of the ethics committee. And then we realized that the ethics committee was not named properly, because it really was a client grievance committee. So I ended up changing the name to grievance committee, and I ended up developing a relationship with the State Department of Public Health, so that true allegations of malpractice I would send there, and then things that were just upset clients or poor behavior, those kind of things, I would handle those internally within CDMA. All the while, I was on the board of CDMA, in my county, which led to higher positions and eventually the presidency of Connecticut VMA.
So at that point, where were you as far as how long you had been out in practice from graduation?
Well, that pig incident, I believe, was in early 1998. So I had graduated about 12 years before.
Okay, so that's interesting. So you found you had a little bit of free time at that juncture of your career. I see that's about right for veterinarians. They begin to feel more comfortable where they're at in their career, and now begin to look outside what else is there. So, and this was a volunteer position, though. Yeah.
Yeah, that's right. It took me about 7 years of just working for others to realize I wanted to work for myself, and then another 2 years to figure out how to do it and save up the money.
Sure.
And so, I graduated in 86 and I founded this practice in 95.
Mhm.
I
All right,
actually,
good on timeline. Where did a master's in public health come in?
well, that came in later after a kind of a chain of events, and I actually made a note to help me explain it. So really what happened with organized veterinary medicine was, just as I was becoming the president of the Connecticut VMA,
Mhm.
I got a letter from a fire chief of a small city very close by here, West Hartford, Connecticut. And if you think about what the year was, that would have been around 2003. So just a short time after 9/11/01. And the state and many states were awash in federal Homeland Security money. And this fire chief had a second volunteer job also. He was the chairman of something called the Capital Region Emergency Planning Committee.
Mhm.
And 41 towns. Now, let me explain. Connecticut's a home rule state. We don't have county government. We have 169 towns and 2 tribal nations. And the towns are grouped into areas that collaborate on certain things.
Okay.
Environmental concerns, transportation concerns, and security concerns. And it's all voluntary. And when they get grant money, they can choose to pool it and do more with it. There's a synergy to that.
Sure.
So anyway, so this fire chief, his name was Bill Austin, called me up, said, are you the president of the Connecticut VMA? And I said, well, I will be in a month or so. He said, well, I've heard that you've been giving talks about disaster preparedness. And you may remember North Carolina pioneered this SART thing, the State Animal Response Team program.
Actually, back in the mid 90s, I want to say maybe more like 1993-ish, I was involved with that because of Dr. Patty Bogue, who did that, for California. She actually wrote a disaster handbook for veterinarians.
There was a few states who independently developed these things. North Carolina, Florida, California. This was sort of going on, and there was a grant. So CVMA got a grant from North Carolina, and one person was going to be invited. 2 people were going to be invited to go to a conference on disaster planning for animals. And in return, and expenses were paid, but when you got back, you had to give a certain number of talks around your state, engage others in it. I'm just remembering this now. And so I volunteered. I thought it was an interesting thing. And, I was savvy to the fact that veterinary medical associations are sometimes in competition with other kinds of organizations in the minds of the public for expertise about animals. And particularly here in the Northeast, we find ourselves competing with humane organizations that sometimes have very different political priorities from the veterinary medical associations. Yes. So I wanted to grab onto this. So I became one of the volunteers, and a colleague went with me. And I came back and started giving my talks, and I gave them at Rotary clubs, at firehouses, to firefighters, to different sorts of groups. And that's how this fire chief heard about me. Somebody heard me talk, said, Bill, this is somebody you're looking to meet. And so he wrote me. I ended up meeting with him. I went to his office, and I went up there, and he throws this giant loose leaf book on the desk. He says, turn to section 13. And section 13 at the time was emergency support function 13, animal protection, and the 2 ends of the folders were empty. And he said, he points his finger on the table. He says, it's my duty to find a way to plan for evacuation of domestic animals when we evacuate our citizens. Will you and your organization help me do this? And so, I kind of, the hair stood up on the back of my neck, because I was looking for a way for the Connecticut VMA to own a project like this. And it kind of became my thing during my presidency, and in the many years since. That's going back now, what did I say, 05 maybe. And so, so I started meeting with him. I said, what I said to him was, I said, yeah, we're willing, but it's going to cost a significant amount of money. and we don't have it. We just don't have a way to raise it. And his answer was, don't worry about money. Just
because of that Homeland Security
Yeah.
funds that were coming up in that time period. Sure. Mhm.
You write me a plan and give me a budget, and I'll get you whatever you need. So I went back and I talked to North Carolina SART. They helped me. I don't know if you knew any of those people.
No, I didn't.
But
I was in California at the time, and we were looking at earthquakes. So there you go. Yeah, from that viewpoint.
Jimmy Tickle was one of them. He's well-known people in the preparedness, public health practice preparedness area. Anyway, so I wrote the plan. I wrote the budget. I needed $125,000 to start, and when I gave him the plan, 1 week later, we had the money.
That's incredible. What a legacy to be in on that for the North. Yeah. Mm-hmm.
So we ended up having what was called the SART Summit. We hired North Carolina people, and they were advertising themselves as consultants on this because they needed money too. So they came up, and we held this giant meeting, and veterinary associations of all kinds and animal-oriented organizations and the State Department of Agriculture and Homeland Security and a variety of veterinarians from all different walks of practice life showed up. I'd say we had about maybe 150, 175 people there. It was held at the University of Connecticut Law School. They had a giant auditorium. And that was the beginning of what became CT-SART, the Connecticut State Animal Response Team. And so, we broke it up. The state had decided, because we didn't have counties, to develop 5 preparedness regions.
Right.
So our capital region was 41 towns, and each region of the state, and it's a small state, admittedly, formed their own region. And then a state agency had a coordinator designated for each of those. And the thing was the groups of towns were in varying degrees of cohesiveness. My region, Region 3, was very cohesive. Those 41 towns knew each other already. They'd been working together for years on a variety of things, including security. And it was an easy transition. So I basically started just with Region 3, but I knew that if the Connecticut VMA was going to get behind this, I couldn't just do it my region. I had to do all the regions so that everybody felt included. So I solicited, I identified other veterinarians, colleagues, some I knew, some I didn't, who were willing to be leaders in their respective regions. And it became the 5 of us.
So at that point, one of the biggest challenges you must have had is you had to address not only the animal component, but how having animals involved would impact human public health. Is that correct? Is that how you got in that direction?
That's exactly right. At its essence, when you're asking people to evacuate their homes, the governor at the time was Governor Rell, and she had seen images of Katrina and other disasters like it on television, and hysterical people being told to leave their animals behind and get in the boat or get in the car and get going. And she said to us, she actually said it to me, I don't want to ever see images like that on Connecticut television. That's what she said. Politically, it was such a, and we are a state that, we're very, there's a lot of interest in animal welfare in this state. Mm-hmm. It's an urban state. It's a northeastern state, all that goes along with that. People have a passion for animals. There's a lot of law here related to animal welfare. Every year, there's legislation that strengthens the way people are required to care about their animals. In any case, so that all kind of came together at that time, and I had 2 problems. I had to basically leave the CVMA. I had to address Region 3 on a granular level, and I had to help my 4 colleagues in the other regions figure out how to do their job in their regions. And so Region 3 got going early, and we ended up using a component of the Citizen Corps program, which was CERT, Community Emergency Response Team, as the basis that the state therefore could say, well, these people are certified and we can deploy them. Connecticut has a Title 28. It covers workman's comp and it covers liability. So if a volunteer working in state service got hurt, or God forbid, hurt someone else or their property, the state would indemnify them if they'd been through the training, received the ID card, and were a formal part of the program. So it all got very bureaucratic and burdensome in that way, but we saw it through. We became a deployable team. We ended up, so a lot of that $125,000 in my region went to buy equipment and trailers to transport it, which we still have. And then future fundraising then became the next challenge. So we formed the Connecticut Veterinary Medical Foundation, in which to have.
Yeah, and and I see that that led you to being the treasurer, as into somehow that segued eventually into being the AVMA and AVMF treasurer. But before we get there, I want to know how you decided a master's of public health was necessary.
Well, I think what happened was I was doing all these things in organized vet med. We passed legislation. Oh, I didn't even get into that. We passed a bill which is now known as Public Act 0711, and we passed that in 2007, which required the municipalities have wording in their municipal evacuation plans how they were going to handle animals owned by people, particularly the pets. And see, so that created a necessary place for the Connecticut VMA's CT SART program to function. And so we basically made, help them understand that if the towns include this, then then the law will be useful. The function will actually happen. It all had to come together. People had to recognize. Now there were communities that, each community has its own emergency preparedness director, EMD they're called, or emergency management director. And not all were inclined to think this was a worthy thing, the animal part. They were overwhelmed with people issues anyway. But we basically were able to convince pretty much everyone in the state that animal issues were people issues. And that's actually a quote from Kevin Dennison, who was involved with he worked for USDA and NASA. But anyway, I guess we needed a place to raise funds from. So we ended up forming a foundation. CT SART became a program of the foundation instead of a program of CVMA itself. And then we started creating other programs. And you could quibble over whether these are public health programs, but we had a domestic violence program that allowed people who had to evacuate their homes, so word evacuation, a place to temporarily house their animals in an anonymous network of animal hospitals while they found new housing to get away from an abusive spouse.
Yeah, so I was part of that here in Oak Harbor when the domestic violence shelter contacted me and asked if I would take in. I had a clinic at the time, and I had plenty of boarding. So yes, I did voluntarily do that. So it's important.
Yeah. We developed a list of practices that were willing to accept animals, and then we developed a way. We had an executive director at the time who would actually meet a staff from the clinic in an ambiguous parking lot somewhere, and the animals would be transferred. It was like I used to joke about it, call it a witness protection program for animals. But
well, people don't want to leave their pets because they're afraid something will happen to their pets.
Well, I had a staff member. I have a staff member who was unfortunately a party to it. This was actually her idea. This program, Companions in Crisis, was her idea because she was afraid to leave an abusive partner because the partner had threatened the animals. And so that's what led to that. Anyway, it helped flesh out the foundation's role, and then we got involved with other health professions in Connecticut. In Connecticut, when if you are having a problem with substance abuse and the State Department of Public Health finds out about it on their own, or there's a complaint by the public, you're going to lose your license, and it's a lot of very draconian consequences. But at the same time, that paradigm helped encourage people to not get help that they needed and not come forward. So together with the dentists, the physicians, the nurses, and the PAs, assistants, we got together and formed something called Haven. It's the Health Intervention and Prevention Network. And basically, we got the state to agree that if a practitioner admitted they had a problem, had done no harm to a patient, and was willing to accept help, that they would not be disciplined and not lose their license.
So this is so this is a state level of something that's fairly similar to what was the AVMA's diversion program.
Kind of, yeah. It's a nonprofit. It works in concert with the Department of Public Health through a relationship of trust. And basically, you know, if you have a problem with substance abuse or another kind of mental health issue that's potentially compromising your work, if you haven't heard a patient, that's the key. If you've already heard a patient, then
but here you're putting something together which was an offering on a more local level than what AVMA, which is national, had to offer. So this was more of a, dare I say, grassroots way of reaching out to Connecticut state citizens to support them in a difficult time.
That's right. And you know, if you got involved with this program, you know, you had to admit that you had a problem, but then they would provide you services and monitor you, and you would still be able to practice. It would not become public. There was no FOIA allowed, and you would, and if you could overcome the problem and not, you know, and there was no recidivism, you were absolved. You had no, you know, negative consequences to your license, your reputation. And that would, and one of the things that prompted me to get us involved in that at the time was I had a colleague who had a substance abuse problem, and he ended up killing himself, you know, accidentally using drugs. And I kind of never forgot this guy. I won't mention his name, but I kept up a correspondence with his mother for a long time. And so this program, from my point of view, for the veterinarians, would spare future colleagues what this poor guy went through. You know, he left behind a wife, and it just was a bit of a tragedy. So,
absolutely,
it was another way of helping. And I feel that, you know, I take the veterinarian's oath kind of seriously, and I look at it and I say, you know, it's a duty I've accepted, and it gives me a lot of self-esteem and pride when we can be something more. It's not just about earning a living. Yeah, I got to do that, absolutely, but at the same time, I mean, I know you came through school around the time I did, and it was conveyed to us that in return for the honor and privilege of being a veterinarian and earning a living in this way, we owed something more to society, and that we should seek out ways to pay that back. And
well, you know, I think you're onto something there, because right now, in listening to social media and in my role as a pet food safety master's, that's my master's of science in pet food, in food safety with the concentration on pet food. I listen to customers and clients complaining endlessly about how veterinarians are bought and paid for and getting kickbacks from pet food companies, that they don't trust veterinarians, and so on and so forth. But then how do you overcome that? Well, what I learned last year, again, from social media, a deeper understanding of social media, was what you have happened on to in your from almost the beginning of your career, that if you are giving back to society, you can gosh, it's not, I don't mean this to sound self-serving, so it's not at all that way, but you have strengthened your reputation, I think, ultimately, in a way. But at the end, you are really giving. You are embracing your role as being part of the community and taking that to the level where you are giving back at an extraordinary degree. And again, I'm not necessarily tooting your horn either, although I feel like I want to do that. But on the other hand, this tells me a way that veterinarians can overcome what is now devolving of their reputation as a whole amongst customers when it comes to, as again, pet food. So this sits in the back of my mind as a very important way of giving us to really maybe reclaim our old reputations that we used to have, where people looked at veterinarians and held them in esteem. And am I saying that correctly, would you say?
No, that strikes a chord with me. I don't think we've lost our reputation, but I do hear, when I hear, I don't know how to characterize it. If I characterize it as complaining, I do not diminish the challenges, the unique challenges that our younger cohorts have to undergo. I certainly didn't graduate with the kind of educational debt that they had. I mean, of course, things were cheaper then, yes.
No, you're right. This whole thing
but-
about going to college right now is exponentially high. Yes.
and I
Very
have
much so.
my opinions and my theories about that, but the main
Sure.
thing is I don't diminish these challenges. And I hear, I don't follow social media closely intentionally so, but, I know that there's a lot of stress because clients are abusive, I'm hearing. Of course, clients have always been abusive because human beings can be that way. And I know they have debt that's 20 and 30 times more than I had. I think I graduated with $20,000 in debt, which at that
Me too.
time for me,
Not very, yeah, that's not considered very much. Yeah.
no, not now, but
Not now.
for me,
Back then it was like, wait, over half my paycheck is going to pay my student loan.
yeah, and the pay was
Yeah.
a lot lower for us, and we accepted that, and that's how it was. And I don't think it's bad that now we're compensated. Of course, that we're compensated as we should be. But I think that the conversations about the challenges that we face should stick within our profession. I think our public face really needs to be what it always has been, is that we're competent, we're professional, we're altruistic, we're service oriented. That's a public message. It's like, do you always want to air your dirty laundry in public? Well, I'm thinking probably not. I think the conversations about our shortcomings, should be had. Wellness, whether we have adequate diversity, whatever these challenges, the debt, these challenges have to be addressed. But I don't think they should be addressed publicly, because outside of our profession, they're not going to understand. And we don't want to, that if you read the veterinarian's oath, at least as it's written currently, and I know there's talk about changing it, but as it's written currently, there's not a word about our own self-interest or ourselves. It's all about using our skills and our knowledge to serve society and to take care of others. Public health, animal health, all of that, what it says. And I think that's the public image we want to convey. We don't want to.
Oh, absolutely. And that is truly who we are. I can't think of a veterinarian I've ever met that was self-serving. And I think it crushes a lot of us as veterinarians when we're accused that way. So that said, you mentioned public health. And I know that a lot of the veterinary colleges are starting to offer a dual degree, and the dual degree is the DVM, Doctor of Veterinary Medicine, typically with Masters of Public Health. Some of them are offering Masters of Science in Food Safety. I personally went to school much later in life, is just actually the past several years, in getting my Master's of Science in Food Safety, because I love food safety, as I learned from the military. That said, here you were interacting and working at this level of in your state government, so to speak, with these different programs that you founded, and somehow that really resonated with you to get that Master's of Public Health, and ultimately led you to our organization. So where did you get your Master's of Public Health, and how did you do it?
Yeah, I went through what is called the Executive Program in Public Health Practice at the University of Minnesota.
Oh, okay. Was it online?
Some of it was. I did a fair amount of coursework online, and then as a required component of the program, you went to the campus in residence for a certain number of weeks or months per summer. You had a certain window you had to do it. I went out to Minneapolis, St. Paul 3 times, 3 summers in a row. I think I did 2 weeks, and 1 week. And there were, you were in class all day with a cohort, because you went through in a cohort of 35 or so. Kathy Jorgensen, if you know her, she was in my cohort, and Joni Sheftel, I know you know her.
Yes, Jody. Yeah, she just received our award that we give out annually.
Right. She was not in my cohort, but she was involved in organizing some of the classes and some of the other aspects. I can't recall every detail. So what happened was I was running these programs or collaborating with others on them, and I got asked to help start an organization that brought together the state animal response team programs across the country. They were just looking for someone who had, I guess, some leadership experience. And so that organization became the National Alliance of State Animal and Agricultural Emergency Programs, NASEP. And you've heard this, NASEP, have you heard of it?
Not at all, no.
It still exists. Integral to it was Kevin Dennison. I mentioned his name earlier, and another woman named Jeannie Lynn. They were USDA employees who had this idea that we had to coordinate nationally to support each other. So that was the idea. Because some states would have an emergency at one time, and others there was this whole concept of mutual aid. And meanwhile, I've been taking classes. I've gone to Cedar Rapids, and I took an agricultural terrorism program.
Oh, those are interesting. I think
it was called Ag Terror. And then I spent a couple of weeks in Anniston, Alabama at the Center for Domestic Preparedness. They had another type of disaster preparedness program. So I had been sort of building up this portfolio of skills or expertise that, was all related to this whole thing of response to disasters and terrorism incidents, and just basically supporting animals in a time of disaster. And then I got involved in NASEP, and I kind of realized that maybe after practice or simultaneous with practice, it would be possible for me to develop a new career, one that wasn't just volunteer, but I felt that in order to do that effectively, I needed a credential. And so I looked at a few different ways of going about this. There were some Homeland Security degrees that were offered, including one through some of the military academies. They had a bunch of different programs. I think there's one called the Naval Special Warfare Academy. They had a bunch of different, but I realized that within veterinary medicine, the Master's in Public Health degree was an understood and respected degree, one that would track you into certain positions if you wanted to be a state veterinarian or a state public health veterinarian, or just a local public health. There was a lot of options with that, whereas all that, the other kinds of degrees, they were more oriented towards law enforcement and military type things. And since I don't have that background, it just made more sense. So I started looking at MPH programs, and Iowa State had one and Minnesota had one. And I think the timing worked out for the one for me in Minnesota. I ran into Will Houston. You know him, Will Houston?
No, I don't.
He's an academic, was at Minnesota, and he was integral to this program. I ran into him at a conference, and I just asked him about it. I said, is there a place for a guy like me? Because I was already in my 50s in your program. Do you think I'd be capable of being successful in it? I was a little insecure about it, and he encouraged me. So I started the program. I applied, and they accepted, and I had a plan, and you had to have like a project for it. And so all of this that we're talking about really became my master's project.
I figured as much. That's a good way to accomplish it. You get it done. You have the program setting milestones that you had to reach. And I pretty much did the same thing with mine for my project as well. And that actually developed into my pet food vet channel. So I well understand how
there's some parallels in our careers, I think.
Absolutely.
It's fun. So I started the program, I want to say in late 07, and I got the degree in 11. It didn't take me the whole 4 years, but my wife will remember I spent a lot of evenings during the week studying. Our daughter had gone off to college, so I used her room as a study center, and I took all the classes. We went through statistics and public health communication, and just all the food safety. plenty, a couple of courses in HACCP and that sort of thing,
Yeah. Yeah, I tell you, I really enjoyed my master's. I
Yeah, me
had
too.
the most fun in those classes. I surprised myself. I had not done all that great in epidemiology and toxicology in vet school, but 30 years later,
Well,
I
you're
did
more,
really great in my master's program for those two subjects, so much so that, my gosh, I was seriously looking at getting into the board certified program for toxicology, but then I don't know, some kind of like, the sanity prevailed at that
yeah.
point. I thought, oh, that's going to take 5 years. What are you, crazy?
Yeah, well, it's funny you say that because I gave serious thought to following my colleagues into the preventive medicine college.
Oh,
And
sure. Yeah.
trying to
Well, you'll
prepare for
find that is just a year of study, my friend, and then you get to take that board certification test. And I'm
Yeah.
positive you would do great with it. And that's far more achievable than my completely insane idea
Well,
about getting boarded.
I ended up abandoning it. Just
Uh-huh.
I just didn't have the capacity, the bandwidth at that point
Oh, sure.
to go further. And I don't know if I would have succeeded at it or not, but I had always aspired to be board certified somehow, and that was a way to do it. But I'd taken it as far as I think I could
Mhm.
in my mid-50s with kids in school and just busy life.
But
So,
remember, veterinarians, we get bored easily. We have to have
yeah,
2 or 3 or 4 things to do at any one time.
yeah.
And dare I say, we're very usually we're blessed with very good health. And that gives us quite the capacity to push ourselves. So that said, as I wanted to really ask you, as we start to wind down over the next several minutes or so, I wanted to ask you, what brought you into your involvement with as a clinical veterinarian? After all, there you are, still running your practice, and obviously happy and satisfied with that. And now you have your master's in public health, and then you like, why join the American Association of Food Safety and Public Health
Well,
Veterinarians? Why
that's a
are you
simple.
drawn to that?
No, that's simple. It's an easy answer. I've invested a significant amount of time and energy and love, if you will, into developing this expertise. And I want to be associated with others who have that same expertise. I don't want to lose what I've learned and what I've gained. And so I don't know where it's going to take me. And because I'm getting close to getting out of practice entirely.
Oh, absolutely. Yeah.
I'm looking at it, and I probably should be looking at it a little harder, but I'm sure I'll have a post-practice career, and it's probably going to veer off into something associated with public health, because it's not something that requires necessarily, manual dexterity
Right.
or interaction with individual clients. I just don't want to lose touch. I spent a lot of energy to get this, and there's actually a lot more to it. But that said, I just don't want to lose touch. So by being
You see that
connected,
one of the things that we benefits is really the networking,
of course,
and now that I am completely enmeshed in revising our website, and that's going to be set up under a company that has a membership association membership software as well. So now we could really serve our membership. And so you should see this come to fruition in June. And I'm going to be devoting the next couple of months to making it happen. So anybody looking at our website right now, it's served our purpose over the past, I guess, 10 years. And we're going to take it now to the next level. And people will find that we will have a job board set up. We will have the ability for individuals like yourself, as an example, to submit blog posts, that they can also submit white papers, as an example, a white paper on veterinary public health, veterinarians and food safety. So there's an opportunity for reputation building where people can get their name out there for their particular expertise. And they don't have to think to themselves, oh, I've got to, how do I submit an article to a journal and so on. That's not at all the case. You'll be able to submit to our website and have your article come out for folks to see. And so we are building very much it with an idea towards being available as a resource to veterinarians in clinical medicine. And we want to be able to say, hey, if you have a situation come up in day-to-day clinical practice, we are here. You could reach out to us and get some type of answers. So in the past, I think we would, be able to potentially reach out to perhaps other areas, like at one point AVMA had a message board, a discussion board set up called NOAA, and things of that nature. But with our particular website, as it's coming up and will be available hopefully before the end of June, clinical practitioners will be able to reach out to us. You don't have to be a member of our organization, but still we will have a public directory. It will talk about, the individuals in our organization who will be available for consultations, and people will be able to reach out to them. And a lot of our availability, even posting to us in general, saying, hey, I want to contact somebody in your organization. You send us your email, and we will find answers for you and people to answer that for you. Now, on the other hand, if you do want to join us, we might be the cheapest organization as far as dues, wouldn't you say? I think we're right at about $42. I suspect we're going to stay under $50. Yeah. And we do have the ability to network. We do have a job board that is going to be coming up and will be valuable to people as well. And there will be different types of jobs that you don't see. If you go to the AVMA, this is my go-to place. If I'm looking for jobs, I typically go right to the AVMA job search, and I'll, stay on there for a bit and go through all their different types of filters and so forth. But the types of jobs that we have posted are ones that typically will not be on AVMA. I don't know why, it just works that way. Because I've seen them come across on our e-list, which is a really low-tech way of putting out job stuff, but it's more of a thing where our members, there's a few hundred of us, will say, hey, there's this job coming up available. I want to put it out there because, I feel that anybody in this organization would be qualified to try out for it. So wouldn't you say that things you've seen come across on our e-list were useful, especially our newsletter?
Yeah, absolutely. The newsletter, very useful.
Mm-hmm.
Yeah, I mean, and I think aspirationally, the broader we reach out over time, I mean, if we can reach 1,000 members at some point in the future, that starts to look like we could be a member of the House of Delegates.
Oh, we actually are.
Oh, we are. Okay.
Yes, surprisingly.
We
and
are.
The reason that happened was because we were originally the
merger.
two separate associations.
Right. Food safety and the public health. That's right. I forgot,
Yeah. And see, this is where we ended up combining, because membership was falling off, and we have to have a certain amount of AVMA members who are also members of AVMA, as well as members of our association. So we have delegates, certainly, but I'm telling you that that because we do have this ability to interact with AVMA, we ultimately are also affecting legislature. And so that is where, again, you could make a difference if you are involved with our association. And you did mention leadership in veterinary medicine. Our organization has the ability to get involved at in these different roles and learn about how to be a leader in veterinary medicine without, without getting lost in a big, gigantic organization.
Right.
So, we're small but mighty, and actually I do intend and hope that we keep growing. And I do want to invite clinical veterinarians like yourself to join us and see where you can go at the next incarnation of your career, because that's what I hear you telling me. You're saying,
that's right.
okay,
Right.
I think I'm at that critical junction. I've kind of set myself up.
Right.
What's next? Hey, I have so many options now, right? And
Yeah.
so that's what I want to impart to clinical veterinarians. We're here for you on very many levels.
That's right. And I penned a few notes, potential closing messages before we began. And one of them is that, one shouldn't abandon areas of the profession that maybe you're not presently interested in. You should try to hang on to that flexibility that veterinary medicine offers. It's never too late to shift your focus and add a new experience. And certainly I did. And the other thing is you never know what opportunities are going to arise from networking with others in other parts of the profession. And all those opportunities are chances to perhaps educate oneself in another area of the profession. And that may come back to you someday in the future that you cannot envision now. So I would hold on to all those experiences and opportunities. And I think with all these MPH programs out there, I get the sense there's a lot more young people deciding to grab that degree now, even if they're not going to use it right away, and sort of have it in their pocket to use in their career sometime later on. It's certainly more so than when we were graduating. So I think that's a good thing. I think that's a very good thing.
Yeah, in other words, it's never too late to plan for various incarnations of your career. And that if you are involved in something or interested in something, embrace it and don't let it go. So I got to tell you, I'm inspired. I like you, I was in clinical practice, or you are in clinical practice, for a very long time in my career. I only went into the military 14 years ago and got out just 2 years ago. And I have to tell you, I didn't really come to public health or food safety in veterinary medicine until relatively recently in comparison. But I am just inspired when I see folks such as yourself who are in clinical veterinary medicine, and they're seeing the value in exploring these other areas of food safety and public health. So thank you for reaching out. I know when we began and we talked just briefly before we started the recording on our session now, you had said, hey, I don't know if my life would be of interest for this particular channel. And no, you actually are exactly the veterinarians that I am trying to appeal to right now, and tell all of you as clinicians, you're working every day with public health, and you have us to rely on as an association, that we will support your efforts if you ever have questions. And then likewise in the future, if you're looking at some point stepping away from clinical medicine primarily, and then going more in depth into public health or food safety, then we're the people to help you achieve those career goals. So again, I want to thank you for spending a really in-depth time. And I have to tell you that I am particularly excited that we were able to talk more in depth, and even at, dare I say, an esoteric level, about what it means to be a veterinarian. And I think that people will find this of value. And I hope that folks will stay for this entire podcast, because even though it took, little over an hour, it's been chock full of interesting stuff. So tell you what, I look forward to talking to you again, and thank you again. Before I close, do you have any final words you want to impart to particularly the clinical veterinarians out there, or any of us?
Well, thanks, Don. I guess I'll just say we're so fortunate, and I have personally nothing but gratitude to be a member of really the greatest profession. And since you're a veteran, I'll invoke a quote from a famous naval aviator named Jimmy Doolittle. He was a very prominent hero, World War II, and his memoir is entitled "I Could Never Be So Lucky Again." And I think that's how I feel about my profession. I could never be so lucky again.
And all of us feel the same way too. So again, folks, this is the 9th episode of our first season. And I believe that every single veterinarian I've talked to so far has been grateful that we've been in the veterinary profession. So thank you again, and goodbye for now.
Thank you. Bye.